All right, we have Aaron Derfel on the line. A story that came out this morning. Don't know if you heard this. Montreal Economic Institute releasing a study this morning showing that 1 in 10 Quebec patients left an ER, an emergency room, without ever having been treated last year. Aaron Derfel, of course, the award-winning health reporter at the Montreal Gazette. Aaron, we've talked so much about emergency rooms and wait times and everything else. When you saw the story this morning, what was your first reaction?
Well, I thought it was a very thorough report, and I'd written about this a year ago, focusing on Montreal ERs. So it wasn't that much of a surprise, but, the situation is getting worse. So, 5 years ago, it was 10% who were leaving without being seen, and in 2024, it was 11.5% leaving without being seen. So it's going up, and perhaps what, the most troubling statistic is that 27.5% of those who were leaving the ERs, that they were P1 to P3s. These are priority 1, priority 3 patients, urgent patients. And 5 years ago, those who were leaving is 21.9%. Wow. So it's scary because there are people who are leaving who should be seen by doctors, but they're leaving anyway because the waits are so interminably long and the ERs are so congested, and they see that the patients on stretchers sometimes waiting for days, and they just can't hack it, so they leave. But they could be leaving at their risk and maybe even dying at home.
As people listen to this and you're running down these figures and thinking to themselves, how is this possible given the fact that we are spending, I'm guessing, maybe I'm wrong, more money, more time, more resources to try to make the system better, yet nothing seems to be working to do that?
So you're right that spending on healthcare is rising. I think it crossed the $60 billion mark, in this latest fiscal year, 2024, 2025. So it is rising, but we've got a shortage of health personnel, especially nurses and on other floors, so they can't transfer the patients. And, just a day ago, the government announced because of the summer and because of the vacation period, we're going to have 1,500 fewer beds. So, because the nurses obviously have to go on vacation. So the situation is going to get worse. And something, for your listeners, when I was focusing on precisely this issue, which is a known issue, leaving without being seen, at some hospitals it was as high as almost 20%, or 1 out of 5 leaving without being seen. So it just speaks to the aging of the population and a shortage of staff, and this is a problem that we're now noticing in England and Spain, even Sweden, across Canada and the United States.
I'm trying to... And by the way, we should mention something else here. And, this idea, yes, the numbers are higher. They keep going up, bad enough. On top of that, they say here, patients who'd been referred to ERs by another health professional are not even counted in this. Yeah,
exactly. So that suggests that in a sense this is an underestimate. And what they haven't probed is how many of these people, died at home. There have been cases, news stories where of people going home and then dying at home, dying from a heart attack or something else. So that would be an interesting follow-up, and maybe I should look into this. I'm just realizing it as we speak.
I'm wondering, too, with respect to Christian Dubé, the whole reorganization of the system. It's funny, I was talking to a doctor yesterday on the show, Martin Potter, who used to work in the public system, who's now gone private, and trying to explain why he decided to leave. And, of course, he's one of many who have decided to leave public to go into private practice. And I don't want to say his practice is flourishing out there, but, the $150 that it costs you for a 15-minute appointment, roughly, there are people going there who, no one wants to have to spend that kind of money, but that's what it costs to see somebody, and people are not complaining about that. And I wonder if the government's push to try to convince more doctors to stay in the public system because it's bleeding doctors to the private system is really the right approach here.
Yeah, okay. So, for some people who they're worried about something, it might not be that serious. Yes, they have an option perhaps to see a doctor who's opted out of the public system. But you have some people who are, a lot of these people are in their 70s and 80s. They're suffering from congestive heart failure. It's hard for them to breathe. They can't go to a family doctor. They've got to go to the ER. And that, contradicts the position that the statement sometimes the health minister has been making, that a lot of these people are going to ERs. They don't really have a problem. When you have an increase in the number of priority 1 and priority 3 patients who are leaving the ER, again, that just speaks to an outrageous crisis. And I'm sorry to say, there are no easy solutions, to deal with this.
Well, which is my next question. Obviously, there are no easy solutions. We're beginning to understand that, and we have for a while. I wonder now, so yes, summer's a bad time. It's always the case because people go on vacation. Is this a matter, is it time for the government at least to reach a deal with nurses and finally get that over and done with? Where are we on that?
Oh, yeah, that's been going on. And I think the big stumbling block is that the government wants to be able to displace, it's the term that they're using, displace, to allow nurses to work in other places. They might be working at St. Mary's Hospital, but if the pressure increases, say at the Jewish General, they would be reassigned to the Jewish General or another hospital. And the nurses are fighting this because it interferes with their work-life balance and other issues too. Again, really, no easy solutions. Try to get try to meet up with a family doctor. Try to stay healthy. You can also go on the website Index Santé, and you'll see that in real time some ERs that are not so overcrowded. The Lachine ER is not very, very overcrowded. The Jewish General, the numbers are usually very high, but they're very good at moving the patients to the hospital, and so that's what you can do. And but it's, what can I say? The picture out there is bleak.
That's the last thing you want to hear, but that's the reality of it. The picture is bleak. Do you get any sense from the health minister in this whole reorganization that things are, at least when you look at it long term or out into the future, a year, 2, 3, are going to get any better based on what's happening?
Well, the health minister is pinning his hopes on Santé Quebec, that new agency that he set up, and the goal here is to depoliticize healthcare. Sometimes I'm at a loss to understand what that means, but that's his hope, that these managers will somehow be able to run the system more efficiently than the pencil pushers in Quebec City. But they tried that in Alberta, only to unwind it a few years later. This kind of centralization push. What's often lost in this conversation is the pursuit of excellence that's patient-centered. There's a lot of focus on structures and reorganizations, and I wish that the focus could return to how everyone should really focus on innovation, for what's best for the patient, and to follow best practices, because there are hospitals that are doing better than others. And we should emulate those hospitals that are able to move the patients through, their wards more quickly than others. And that's, I think, the only thing we can really try to do amid, the aging of the population and the shortage of doctors and nurses that we have, a problem which will persist, I'm sorry to say, for a few more years.
Did you see that number in this story on Dr. Potter, that 93% of all vacancies for family doctors, 93% across the country are from Quebec? That's how short we are of doctors.
I think what's happened here in Quebec, we have this bureaucratic policy. It's called the PREM policy, Plan Régional d'Effectifs Médicaux, and it was designed to address the shortage of family doctors in outlying regions, and now it's really rebounded, and it's penalized Montreal. There was recently an op-ed I was pleased to see in the Devoir. So that perhaps that's turning off some people, turning them off to going into family medicine. But I think that this is a problem that you're observing North America wide, that doctors are not so interested in family medicine the way they were in the past. And I don't know what has to change. Everyone wants to specialize, but we definitely need family doctors. And certainly on the island of Montreal, it's really horrific. And that's why people out of frustration, they end up going to the ERs. And that's why you were saying earlier, if you can go to that private clinic and pay, you'll get that quicker access. But as I said, these more serious cases,
Sure.
They have no choice but to go to the ER.
Wish there were some answers here. Just more questions, more problems than answers. Aaron, as always, appreciate the time. Thanks so much.
My pleasure.